Welcome to the Littleton Board of Health Wednesday, December 2nd Zoom meeting. I'm just going to read the Zoom waiver. Town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns related to the open meeting law have been brought to our attention by the town clerk. These concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring but is not moderated or followed by the chair. All participants and listeners may not be aware of the comments being made because some of the meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated into the public records. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during the public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you call in by phone, please use *6 to mute or unmute your phone so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you call in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson if the raised hands on the will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute, then state their name and address. After speaking, we request that the participant return their microphones back to mute. So almost everybody's here. Louise is connecting. So I don't think we have anything on the agenda, no public hearings at all tonight. So we're just going to have a COVID update, and Katrina couldn't be here, so I see Corey are here tonight too, so maybe they can give us some information on anything that they know. So I guess we'll talk to Jim first. Hi, Jim.
Yep. Hey, how's it going? How are you?
Great. How are you?
Good, thanks. So lots of cases. Not necessarily in Littleton, but just lots of cases. Like today, there was probably almost 70 cases district-wide that came in our district, the health district. And so we're seeing in lots of the towns, the numbers going up. I don't know if this is the beginning of what happened with Thanksgiving. There did seem to be a little dip, a couple of like the end of last week, but the cases seem to bounce again. So trying to do a little bit of kind of advanced warning, if you will, on the risk map that should come out tomorrow. If I kind of looked and calculated the numbers right, it looked like Littleton may be in the red again, so that'd be a second week. What's the kind of concern with that is 3 weeks in the red rolls the town back in one of the phases of reopening. So you go from phase 3, step 2 to phase 3, step 1. And it kind of nibbles things off around the edges. So retail space has to be a little less occupancy, and there's a few other things, gatherings change. So I'll kind of keep an eye on that. From the past 3 reporting periods, the numbers in the last 2 have been the same, and they're a little bit lower than the one 3 periods ago, 3 weeks ago, essentially. And hopefully it's a slow downward trend, but it seems to be stable at this point. So I anticipate tomorrow being, indicating that towns are red again for this week. We have had some additional complaints, and I've done inspections at facilities, trying to just, again, we've gotten a handful from the state, other ones that have just come in by way of email. Some of them have resulted in inspections of facilities. Went through Dover Salary. They actually had somebody, we got a complaint to the state. For the most part, they seem to be doing the things that they need to do. We did discuss some things that they could probably change. One of the things I'm not sure businesses realize, although more of them are realizing it now, is that when you have a case, someone in the workplace tests positive and they tell you that's the case, they're supposed to report it to the Board of Health just so we can have a conversation about contact tracing. So that's probably the biggest thing I'm seeing when I'm going to these facilities is their lack of knowledge on that. But as I've gone around more and more, I've had those conversations with businesses. The board had asked me to go up and talk to Market Basket, which I have done. Interesting, the day I went in there to talk to them about it, they were doing just as you had described, having like the store manager and assistant manager actually managing that front area where the registers were. Matter of fact, I had to pull one of them away from it so I could actually talk to them about what it is you wanted to do. Bay told me that on days that are really busy, they actually close off one of the doors and then kind of moderate the flow coming into the front door. I did explain to them that the board would like them to start doing counts in and out so that people know that it's happening conspicuously, and to make sure that they're doing what they can to modify that front end, including having people actively manage it when things are busy. You're on mute there, Lisa. Lisa, you muted.
I think it would probably be a good idea. I think we talked about it last time or 2 weeks ago, that it probably wouldn't be a bad idea to roll back to that capacity limit and one entrance way. It seemed to work, you know, and it makes people understand it's serious enough that we should be thinking that way again.
Yep.
And question, Jim, who tells the town and the if we go into red for a third week, who tells the businesses to? Is that something that your office does, or is
Sure, we would do that. So, I mean, the town of Shirley went to. It's not a high risk town. It's a town that's no longer considered low risk. That's state lingo for a high risk town. So what happened was, and again, they sent me an email, one of these offices from the state. Unfortunately, they didn't put which town it was. So I had kind of pulled the number, so I knew, at least I thought I knew which town it was. And they were a little late in updating the website. There's on one of those reports, on that report page, there's a list of towns that are not considered lower risk anymore. But I would reach out to the retail businesses. I'd reach out to the businesses essentially, and I'd let the town know as far as gatherings, because that's the other thing that gets affected. Your gathering sizes shrink a bit too. So the state has a nice little worksheet for people or for communities when you roll back to phase 3, step 1, so you know what the differences are. And I can send that out to you.
Okay. I have some other questions, but does anybody else have any questions for Jim tonight?
I do.
Okay, Louise.
Jim, on all the graphs that we see from the state, you know, obviously the numbers are going up, but it doesn't look like the numbers for the hospitalizations are going up as much as the numbers for the cases of COVID are. Does that mean that we have experience with it now and they know which cases should go to the hospital and which cases shouldn't?
I think that's part of it. When you hear people talk about it, they know what they're dealing with a little bit better. They've been seeing the disease now for 9 months. I think the other thing is you look at who's getting tested and who's testing positive. That number, I mean, it's if you look at the last report, the majority of the people getting tested are those people, it looks like 59 and younger. And so I think that probably has something to do with it too. I wish I knew exactly why, but those are the things that appear to me when I look at the information on the state website.
Okay, yeah. Thank you.
Yep.
So as far as I can make out from both the states and from Katrina's very useful sort of up close and personal summary, our region, if you look at our region, Jim, I think you'd agree, which incorporates your district, is that our region is trending in the same way that the rest of the state is going, obviously.
Yep.
Up. Yes. And we're not even, let's say, we're not even 7 days yet out of Thanksgiving, right?
Correct.
So we'll know whether or not the information effort that was made anywhere about masking and all the rest are going to pay off, because I guess that's when we'll start seeing people reporting, I guess, if there are any new cases.
No, and one of the things we were saying, Mike, even before this, probably since the beginning of November, we've started to see the increase in all our towns. And where we're seeing a lot of the increases are in families. So if it ends up in one person in the family, it's likely it's going to be in more than one person in the family. So some of our towns, 4 or 5 people in a household have it. So the numbers are high, but sometimes it's because you have multiple residents with multiple family members.
Yep. And also compared to where it was earlier in the year, the state is really wide open. I mean, all the major highways and all the rest, people are moving around quite a bit. So it wouldn't surprise me if stuff gets carried around and back into families' houses. And let's put it this way, it's out of control.
Right.
Hi, Lisa.
Hi, Gino. Jim, is there, I had a couple of people ask me this weekend, is there a place on the CDC or the state website, specifically questions like frequently asked questions, or maybe we can do it? It just seems like it's so confusing, like what to do when you are exposed, like when to test, and another thing is what to do when you do test positive. Did I see something say that it's going to be down to 7 days now instead of 14 or 10 or something like that?
So a few things there. On the 18th of November, the Department of Public Health changed the quarantine guidance that we use when we talk to people who are close contacts to people who test positive. So the quarantine used to be 14 days, regardless, and you couldn't test out of it. From what the Department of Public Health epidemiologist has stated, that I guess a vanishingly small, her words, number of people go from being close contacts to testing positive after the 10th day. So that was their rationale for changing the quarantine process to 10 days. If you test on the 8th day after exposure or later, and you remain symptom-free, and you agree to monitor your symptoms, you can be released from quarantine in 10 days. The isolation, go ahead.
No easy answer.
No, and so we've had some close contact situations where I always like to email the people I'm going to talk to the paperwork ahead of time, so they can actually look at it and have that list of what to do, how long quarantine lasts in front of them. Because once you start explaining, so if you do this, if you do that, make sure it's a PCR and not an antigen. I just want to make sure they have all the information, because the old quarantine information, we were recommending that people get tested 4 to 6 days after their exposure, just to to give the virus a chance to have maybe started to replicate in the body. Now it's more advantageous if you're trying to get off quarantine sooner to do the test on day 8 or later. So.
Right. So is that kind of information on the state website, or where?
Those are tools. I could probably get. So there's a set of procedures and guidance for quarantine. There's a set of procedures and guidance for isolation. Isolation is for those people who actually test positive, and functionally, what you have to do is the same. You really have to kind of stay at home, not have visitors, keep away from other people in your house through that period of time that you're either quarantining or isolating. But in the case of isolation, because you're sick, what we're looking to do is have kind of wait out the disease. We're trying to get somebody to get better from the disease. And so in the case of isolation, it's 10 days. The last day or so has to be fever-free, symptom-free. So it's still a minimum of 10 days in that case, but we're looking for more of the resolution of symptoms at that point before they're released.
So is that something that you can get us, and Janet, is that something that we can get on the website, the town website? It's like frequently asked questions about what to do when exposed or have a positive test.
I can try to put together, I can certainly get you those 2 Department of Public Health documents. And maybe I can give you kind of an outline of when each might apply.
Okay.
So that, you can read through both of them, but when we do the contact tracing, what we're doing is talking to the people to try to establish, dates of either last exposure or test dates, so we can actually determine those quarantine and isolation dates. So it would be kind of generic information.
Yeah, I mean, again, we're just, we're like Mike said, out of control.
Yeah.
People aren't. What are we? What should we? If they're not gonna stay home for Thanksgiving, if they're not gonna wear masks, what's the next thing that? Because like I said, I had 2 people ask me this weekend, what should I do? And I'm like, I'm not a doctor. So I didn't know if there was an easy, and obviously, like you said, it sounds like there's no easy answer. It's 10 days from this, and exposure, and it's changing, and symptom free kind of thing. But if we could get that kind of information on our website, that might be helpful.
Well, let me see if I can work on to make it easily digestible.
Yeah. And who's Janet? Is it Amber that's here tonight?
I think it's Amber, yes.
Yeah, that might be something that we want to get on LCTV once we figure that out.
Let's take care of your mark.
Okay. All right. Any other questions for Jim?
Have you started, Jim, thinking about or tooling up for the the great vaccination celebration?
Based on what I'm hearing so far, we don't need to worry about it until springtime. Based on kind of the district, they really haven't told us much. So my biggest information is coming from the news and what we're hearing about distribution from the news. But again, CDC did put out a document talking about the different vaccines and the cold storage component of it. And I guess today or yesterday, they decided who was going to get it first at whatever level.
Yep.
So that all needs to trickle down through the states. The states, I guess, can either just accept that recommendation or they can modify it if they feel it's appropriate. So I guess we're waiting for DPH to give us some kind of marching orders.
Yes. Have you seen anything come through about vaccination, being a vaccination candidate, even though you've had the disease before?
I have not heard anything with that regard.
Okay.
Kevin, you had a question?
Yeah, I just wanted to ask Jim, what his thoughts were. I know Governor Baker spoke about the, local houses of worship and churches and things of that nature, and clusters popping up and leading to a significant number of cases. And I don't know if Jim got that email this afternoon from Katrina as well, but what in your opinion, should be done in communicating the educational piece to those places, especially with the holidays approaching?
You mean like churches?
Yeah.
Places of worship?
Yeah, exactly.
Okay.
So we can certainly get, I guess I didn't, I saw that Katrina emailed me. There was another email she sent. I answered some questions about data. And I guess I didn't see another one. I didn't open it up. But, I guess with the exception of the church up in Fitchburg, we really haven't seen churches as an issue yet.
Okay.
The one up in Fitchburg did seem to affect 3 or 4 of our towns that kind of abut Fitchburg. We saw an increase in numbers and cases that we could draw back to their attendance at that church. But I'm certainly happy to get out the information to all the churches in town on the sector-specific information so they know what's allowed. And particularly, I'll have to check and see if their gathering numbers would change based on rolling back to phase 1.
Yep.
So I can certainly take a look at that.
I just didn't know if there's anything we could do on our end to help educate.
Well, I think getting that information out to the various pastors and reverends, whatnot, of the different churches would probably be the best bet.
Okay.
Yeah.
Hey, Jim, this is Gino. According to my priest at the St. Anne and one in Westford, St. Catherine, they allow, before there used to be only 25 people, and sometimes they only end up at like 18. Now they will allow 150. But the question is, it's going to be, the church is going to ask the police to come to make sure that it's going to be a distance of like 6 feet. Instead of they have 1,200 or 1,800 in the church, they only allow 150. And they're going to make sure that people have a mask. Are going to be to to the church in St. Catherine in Westford Saturday. So I will notice more what's going on. They might have police there too, and they only allow people they already registered. You haven't registered, then you won't be able to get in. So it might be a relief from other people. They might think about the church, because our church here in Littleton, they has like, when I used to tape, they'd be like 1,200, 1,700 people. I can't believe it, where they put them, but now they only allow 150.
So I think churches are based both on the number of, making sure you can keep the right distancing, and I think they're allowed to. I think it's based on either their occupancy number or the square footage. I'd have to go back and take a look at that sector specific.
Yeah,
There's a lot of time between now and, well, thinking Christmas,
Yeah.
where they could actually roll back those numbers and not even allow services, probably, correct?
Well, churches may decide not to do that, just depending on what's happening.
Mhm.
Yeah, it looks like choirs and time spent.
Right, singing, no singing.
Yeah, so I said choirs and time
No.
spent. More.
And I think that was the issue up in Fitchburg. I think it was a multi-night activity, and I think they were singing, and I think there were no masks, and so it was the worst of all worlds.
All right, anything else? Board members,
it's fine. Thank you.
does anybody have their hands up at all to ask questions from Jim?
No hands up.
All right, so, I guess we should go to, John. I'm not sure, I see Kevin, Corey, and John. I'm not sure who else might, have some information for the COVID update. Corey, do you want to start?
Sure, I'll say just a couple of things. Really just want to update the Board of Health with some information that came our way maybe a week or two ago with respect to other towns that have been testing, both, taking advantage of the symptomatic testing in their schools, but also rolling out asymptomatic surveillance testing, or just kind of testing the population of students and teachers to make sure that they can catch cases in advance of any kind of widespread, clusters in schools. And it looks like this is gaining a ton of momentum in a lot of different towns. It's really been kicked off by Wellesley, and the person that is leading the charge there is a colleague of mine at the Broad Institute, and has been kind enough to invite some of us to some meetings with some of those other towns, some of the town administrators. And we've been able to gather a bunch of information. And, I think we can serve the Board of Health or the school committee in the capacity of just trying to provide information should this be of interest. And I just want to, avail ourselves to any of you who want to learn more about what's going on in these towns. And in particular in Wellesley, they were actually able to catch a cluster that of asymptomatic folks and stop a major spread within one of their schools just by shutting for 2 weeks rather than having a bigger event. And so it's been gaining attention in the news. People have been covering it. Other towns have joined a consortium. And, we've just, like I said, we have a ton of information that we would be happy to share. So I just want to put that out there for you.
This is Mike. Can I make a comment on that?
Yeah.
Yes. There's been a very useful conversation with the chair of the school committee, and mainly as a result of the town of Littleton is actually on the list or is going to participate in, quote, a state-run pilot program for testing in schools. And I believe it was mentioned in several meetings earlier. Jim, you probably know all about this.
Only because the school was nice enough to tell me.
Well, they were on the list, but apparently Littleton was on the list, but it was an oversight that they were not posted as being on the list of recipients. I mean, good grief. If Lincoln and Harvard can get on, why not Littleton? Okay. Anyway, so what this has done is it's given a certain amount of what we'll call reinforcement or assurance that testing in schools in a particular way makes a lot of sense. And fortunately for us, because of the work that's been done or the efforts been put in by the Board of Health and through the individual advisors, a couple of whom are here, the ability to distinguish between testing that basically is after the fact and that which I call surveillance, where you're going in and you're trying to basically stop clusters from forming in the first place. Surveillance testing, that distinction now is totally understood and in significance appreciated. The other aspect of it is funding. The fact that the state is moving forward with the pilot program means that if it starts working, Littleton can learn a lot and acquire a lot of skill sets or knowledge sets about infrastructure and logistics for doing it. And the other piece is that there's also an appreciation locally of the difference between tests that have to be administered by skilled or semi-skilled healthcare workers and tests that can be carried out at home with results coming back in a reasonable period of time. So all I want to say is that all the information and all the efforts to communicate the, shall we say, the value as well as the pieces that need to be in place in order to do testing and, very frankly, its significance that will help keep kids in school, I think is now more fully appreciated by the Board of Health in very particular form than in the past. So it's the school board, I guess, really has to make their own, as it were, find their own pathway, because the encouragement we've found so far works, but they're going to have to figure out how they can, as it were, both fund as well as implement any of these testing initiatives should they carry it out. So they're aware of the Wellesley results and results from other places that have tried it out or have gone this pathway. What probably will not necessarily impede the process, but confuse it a bit is this gap period that we're in between excitement about it, vaccines being available and when they're going to be administered to which populations and once they take hold and have an effect.
Yep, of course. I think,
So,
and I just want to thank you for, really the whole Board of Health really for that. That's really, that's a huge step in the right direction if we are going to try to keep kids in school. And I think that's a really important point is that I think I speak for the folks that I've been talking with about the whole testing, the need for testing, the need for different buckets of testing. Under that kind of valence of trying to keep kids in school as long as possible. And if you get a testing scenario set up in a town, even if the numbers are spiking elsewhere and you feel confident in that testing, there's a chance you could keep that school open. Therefore, those parents could still work, be good for the local economy and good for the teachers. And I think that's ultimately what is motivating a lot of people to really take this on. Just in terms of a couple of the details that we've learned, a lot of the towns have deployed a survey, and I have that, can forward it to anybody on the Board of Health if you're interested in seeing what some of the other towns have put together, and develop the infrastructure to really get that buy-in from the townspeople, along with other administrators. I think you're right. The school committee has to own the process fully. And again, we would be more than happy to support those efforts in whatever way folks thought we could be useful, mostly through connecting people with other folks that have already done it and have that kind of information at the ready so that they don't have to reinvent the wheel. And the survey apparently has been instrumental in a lot of these towns understanding what the appetite of folks in the town is for a testing program like this. I was reading through one of the surveys earlier tonight, and it's really basically like, what's your comfort level now for your kid being in school? What would it be if we had a testing program? What, you know what I mean? And like, would you be willing to participate? Would you? And it really gauges the level of interest and whether or not it would be practice changing with respect to people and their desire to have their kids either remain in school or stay remote, all that kind of stuff. And then also asks a question about whether or not people would be willing to make a financial contribution to support the effort. And a lot of the towns that have deployed the survey, whether they're wealthy towns like Wellesley or other towns that struggle a little bit more, they're finding that the parents have been willing to contribute quite a bit to see a program like this through. And so it could be really worthwhile to, get the Board of Health and the school committee together, along with some of these people who have really championed this process from soup to nuts and got it out and running, in order to just see if there is the desire to move that forward, and then be able to like take from these folks that have done this, and they're really hoping to make it as easy as possible for new towns to come on board and do this too. So there's a lot of help out there, a lot of willingness, and a lot of learned experience.
Could you send me, this is Mike, could you please send me a copy of, if you can, the copy of the survey instruments used, the questions?
Happy to. Yeah. Do you want me to email it to the entire, I don't know if there's like an entire book.
Corey, why don't you send it to Janet and then she can send it to all of us.
Okay. I'm not sure if I have her email. Is it on the website? Because I can do that. You can get it from the website.
Janet, can you send Corey your email or let her know what it is?
Yes, it is on the website.
Okay. I'll grab it, and then I'll send this to you, Janet. If you could distribute it, that'd be great.
Absolutely.
Mike, have you met with the school committee that you had this information?
No, I had some chats with members of the school committee.
Okay. So is that something that we should do a joint meeting with, do you think?
Or
wait a little while, or?
I would
Maybe I'm jumping the gun. Maybe John knows a little bit more about this, but go ahead, Mike.
No, it's just a question. It's really a question of providing the school committee with some instances so they don't have to, as it were, reinvent the wheel. So the survey is a very important piece of this that will give them some confidence, and the additional, the notion of them meeting with the person or the individuals who really, as it were, have kicked this all off would be a very good idea. But I think, first of all, the first step is the one where they survey their own community to find out the level of interest in it. Or as has been pointed out already, they have to have a sense that the community wants to do this and is prepared to commit resources to it. So that's one of the reasons I wanted to ask for that. And also there'll be another opportunity to offer them the chance to talk to people who already have done this sort of thing. My impression is, this is just an impression and I have to work it through, is that unless it is unless the program is either directly or, and maybe Jim can help out more here, and that is if there is some reinforcement or assurance or support from the state, not necessarily in monetary form at this time, but mainly in what we'll call technical support, programmatic support, advice. If they want to basically start running a program like this, that would be, Littleton and whatever other towns would join in. So Jim, the question is, do you happen to know where the state, I've seen one or two remarks made by the governor and a few other blurbs, but nothing specific about how much assistance or how much guidance the state is prepared. What I have seen are primarily very specific recommendations to vendors and sources and techniques that may or may not fit what the Littleton school really wants to know.
So Mike, I guess this BINEX Now is the program that the state's rolling out to the schools. And there is documentation on how to participate, the doctor's orders that you need, the procedures for doing the testing, kind of a question and answer on what to do with test results and who should be tested. So I can gather that information and have Janet send it out to all of you, so you can see what the state has provided, what DESE has provided to the schools as part of this program that they have.
Now, yeah, you're aware that Littleton is on the list, right?
Yes, the only reason I am is because one of your wonderful school nurses has kind of kept me in the loop as far as what this is happening, because certainly the Department of Public Health hasn't, or DESE. So she's not only providing me with the initial information, but with a lovely PowerPoint presentation that they all sat in on. So got some more information about the program. So I think they provide the kits to the school at no cost. I think the school has to, there's PPE requirement, there's some certification waivers that they need to get. They need to, so it kind of spells out what they need to do in this paperwork from DESE. And again, I can get that stuff to you so you can see what the schools are being provided.
Okay. And just so I'm not giving out misinformation, is that particular test regime, that diagnostic, is that being used to survey, or is it being used after someone reports or has symptoms?
My kind of vague recollection of skimming through it was it's to be used if a kid comes down to the nurse with symptoms, they can swab them and see what's going on. And then depending on the results, they take certain actions, and that information is all kind of contained in the
paperwork. That was all right. That's my, so this test, as I said, this pilot test or system is mainly meant for after the fact response.
Symptomatic.
Yeah, I think they're trying to sort out, is this just allergies? Is this just a cold, or could this be COVID? So I think that's part of, if I understand what they're trying to do correctly.
Yep. Yeah, and Corey, you correct me or anyone else any individuals who've been, but most of this material I've heard about and seen and actually talked to some of the folks in Wellesley about is that they were after, basically, they're basically doing enough testing, surveillance testing, to find out who in the population is frankly asymptomatic, whether they're developing symptoms or not. Does anyone have the virus and therefore is a popular spreader?
That's correct.
So that's it. Yeah. I'm sorry.
No, you're correct in saying that, Mike. So in this approach with the Binax now, it's more of just catching the person that's already in school, as opposed to the approach at Wellesley is testing the pool and finding out beforehand who may or may not have, or who may be infected.
Yeah, and I think the notion, I believe, that we've developed, that our Board of Health has seemed to come to appreciate, is the fact that it's the what we'll call the early surveillance detection, which is going to be the most valuable for the school in terms of making sure that it has the greatest amount of shield, as it were, from the outside, because the schools are not experiencing, to my knowledge, anywhere near the frequency or positivity that's seen in the general public and just yet. Is that right, Jim?
I guess this is anecdotal from just looking and working with school nurses. It seems cases are coming into the school, not being transmitted in the school.
Right.
So you've got cases in a family, whether it's a parent or a child, and I think we're getting a mix of both now. But we're not seeing transmission necessarily in the school. And again, the nurses throughout all of the school districts have just been wonderful at kind of jumping on this thing and acting quick to get people either out and get a list of close contacts. So that's worked out really well.
Okay, so maybe we certainly don't want to discourage the Littleton School Board from pursuing this opportunity, correct? I just want to get a certain sense of, I mean, it's not an either or. We would like to see them do testing, period.
So, Mike, can I comment on one thing? So, sure. One of the takeaways from the the meeting that we attended with the towns that are part of the collaborative is the importance of the infrastructure So by Littleton participating in this pilot program, will in this case, you can look at it as the infrastructure is being established through this program. And then if the town were to decide, if the school committee and Board of Health were to decide to continue on with a surveillance-based program, the infrastructure is already there. So you already know how the reporting structure is going to be and everything else. So the way that this can be conveyed to the school committee is this is a way for, to have the infrastructure set up that's already been paid for by the state. And then whatever this town decides to do from there in terms of the surveillance, it would just be added on.
Well,
So that's one way to think.
I don't mean to steal your thunder, but almost word for word, those are the words I use in my chat.
Oh.
The school committee.
Okay.
Okay, so we'll get some information from Corey and John. Do you think you have different information than Corey does?
No.
Okay. So we'll get you guys will get some information to Janet.
Yeah, Janet, I tried to email you through the website, so let me know if that showed up. It wasn't allowing me to attach the data that were given to us in a PowerPoint from the town of Newton, and so there's both the survey as well as survey results. And so I have Mike Zeldin and Kevin Baker's email, so I can send it to them in case you didn't get it. I'll make sure that they have it too.
And I'll forward it right on to you, Janet.
Okay.
So we should talk about this next Wednesday after we get a
Yep.
chance to look at it. Should we invite Mike Fontanella?
Yeah, we
Or-
might as well, jump on the bandwagon. He by that time he'll be pretty much aware of what's going on. So
Okay, all right. I can get in touch with him and see if he can make our
Sure.
next meeting.
great.
Okay. All right.
Thank you, Corey.
Yes, thanks, Corey.
An effort. We're happy to help.
John, do you have anything more to add?
No, don't.
Thanks. And Kevin Davis, did you have anything that you wanted to add tonight?
Nothing specific about the testing. The exposure notification stuff, the state did release the RFR. I did see a copy of that as far as getting somebody to come in and do the exposure notification. This is really good news from that perspective. And I think, we just kind of monitor it for now to see where it's going. The requests should have come back to the state today, tomorrow, by the 5th or something like that. So definitely by the end of the week. So hopefully beginning of this, middle of December, we should hear something coming back from the state where they're going to stand on doing this. So that is some good news from the exposure notification for our state.
Great, that's awesome. All right, any hands up at all, Janet? Before we move on?
No hands up.
All right. So any board members have any correspondence that they need to talk about? And we'll move on to member comments. Did we have meeting minutes to confirm, or we can't do that because I don't see it on the agenda?
I did send them out, but I figured you'd just vote on them next week during regular
Okay.
business week.
All right. So member comments from anybody? Kevin, I got your email about the TV story, but I didn't get a chance to read it. I got it like at 4:00 this afternoon.
Yeah, sorry, that was late. It's just,
Kind of clue us all in, or kind of.
yeah, there was just a couple stories that were aired on the news regarding the collaborative of, I guess it's maybe 20 plus cities and towns now that are sort of implementing this screening program. How it's,
The same one that we're talking about with Wellesley? Oh,
Yep.
okay.
I think there was a Watertown piece, and one was.
Was it national?
No, it's just Boston News.
Oh, okay.
I did hear the Biden transition team is talking to this collaborative, trying to sort of glean any information they can of how it's being successful and trying to keep schools open. So it's very
All right.
interesting.
I'll get a chance to read that email later on. Mike, do you have any comments at all that you'd like to make?
Nothing except in one of Katrina's emails attached to her slide set, near the end of it, there are a couple of information signages that could be useful on our website. It might be worthwhile for you and Janet to take a look and see if they're useful additions.
Which ones were you looking at, Mike?
Well, if you go to Katrina's slide set and go to slide, starting with slide 18.
Do you know which one I have it on my phone? Is it the pie or the contact tracing or?
This one is contact tracing slows the spread.
Yep.
Okay, and it's all official CDC stuff. It's something
Yep.
original. The next one is mass protect others and protect you. That's actually a fairly new concept, because until recently, And the third one, which I think is probably subtly, is called "Your Bubble is Bigger Than You'd Think." And it really makes the point about what happens when you sit down and with just 3 people. So
exponentially, your bubble has been burst.
Yeah.
Yeah. So yeah, we can. How did we do that, Janet? Did we go to? Do you just ask, or was it Scott that we asked to put those slides up?
I didn't understand that. Sorry, what?
I can't remember. Was it Scott that we asked to put the slides up, or is it LCTV?
Scott and Jim approve them, and then Nancy in IT puts them on our website.
Okay.
Why? Who has to approve them? I'm sorry. Scott who?
Scott Wodzinski and Jim Greffy look at everything before we put it up, just to make sure that it's accurate information.
Okay. All right.
You know, they just have them. They know what's accurate and what's up to date, Mike. So we don't want to put something that might have wrong information up.
Whoa! It comes from these are all from the CDC. We know how accurate they are. Okay.
All right. So Janet, did you get Katrina's email with the slides? I think you did.
I did, yes.
Yeah. So I think what is it, 19, 20, and 21?
No, it was 18, 19, and 20.
Okay.
And I mean, 21 is the Swiss cheese thing, but I don't see anything really
different about that. Yeah.
It's different. The other ones are they're more graphic. I'm not sure they would add anything. They're the kind of thing that you'd like to see sort of scattered around the town as signage, not, I mean, I think they would be useful in the more people see stuff, even if they have to look up in the air to see the banner, it's also good if this were, signages around town, even if they were small, if people actually saw them, it would help reinforce. What do you think, Jim?
I can talk to you about getting that and seeing if we can do some more banners with this.
Yeah.
I wonder if, I know it's probably still appropriate, but the other slides that say it's Thanksgiving, it's appropriate.
I did ask Nancy to take that down, so she'll be taking that down this week.
Although it's appropriate for every gathering, say Friday night, not.
No. Also, you can Photoshop out the turkey. You don't have to leave the turkey in.
Maybe
Jesus,
Katrina
guys.
can update it for the holidays.
Does anybody here know how to use Photoshop?
Not me.
I'm sorry?
No.
It needs to be a requirement for the next board, Mike.
10 minutes. Oh, Jesus. All right. I'll see what I can do with my kludge equipment here. All right.
All right. Any other member comments?
I don't have anything.
Evan, do you know any other comments at all? All right. And public comments?
There are no hands raised, Lisa.
All right. So that's it? We're good? We'll get Mike Fontanella at the next meeting. Corey's going to get us some information about the testing. We're going to look at getting those slides up. We can send those to Scott and Jim. And then Jim, you were going to send me something about like frequently asked questions about exposure, testing positive, isolation, quarantine, the difference in that.
Sure.
Okay. All right. Anybody want to make a motion to adjourn?
I'll make a motion that we adjourn our meeting.
And Janet, when's our next one? Thank you, Mike.
Next
still-
Wednesday?
We'll still meet next Wednesday, the 9th, right?
Yes, 7:00.
I'll second that.
Thanks, Kevin. And we'll take a roll call. Gino, you're on mute. Gino, you're muted.
That's why you didn't heard my motion, because that's why. I got it. Somebody did it for me, did you? Okay, no problem.
So we're taking a roll call, Gino.
Gino,
We've had a
yes.
motion and we've had it seconded.
Gino, yes.
Thank you. Kevin Baker. I'm sorry, Kevin, we went out of order.
Kevin Baker, yes.
Louise Nichols
Louise Nichols, yes.
and Mike Zeldin
Mike Selden, yes.
and Lisa Flanagan, yes. All right, thanks, everybody.
All right.
Thank you.
Thank
Night.
you. Good night.